Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. The feature presentation is: Does aspirin and statins reduce the coronary artery disease complications over a period of years? So let us look at this feature presentation, an article that was presented in the Radiology Cardiothoracic Imaging Journal, looking at aspirin and statin over a period of 5 years in patients with coronary artery disease and in patients without coronary artery disease to see what impact it had in preventing further cardiovascular problems. So this study included, they looked at a registry of all those people who had been worked up for coronary artery disease, who either had shortness of breath, chest pain, or any other symptoms that they thought may be related to the heart. And these people were followed over a period of 5 years. They had a registry which had 27,125 patients in that group, people who had been worked up for coronary artery disease. And in that 5-year data, outcomes were available in 12,086 patients. And in that group, they included for the final analysis 6,386 people based on certain criteria, like excluding people who had stents, excluding people who had bypass surgery, or excluding people who already had some kind of a procedure. They were looking at people with no coronary artery disease versus minimal coronary artery disease. Like you have a 30% blockage or a 40% blockage or a 50% blockage, which does not need any stent or bypass surgery. And they wanted to see what is going to happen to these people when they are treated with either aspirin or statin or both. So that was the purpose of this study. So let's see what the outcomes are. So in the total group of 6,386 patients, half of them, that is 3,571, had no plaques whatsoever. Plaque is a little bump that builds up in the artery that leads to blockage and eventual heart attack. And in 2,815 patients, they had, so you can follow my green arrow here, in 2,815 patients, they had non-obstructive plaque. That is, they had plaques which were less than 70%, which did not need stent or bypass surgery. So that's the two different groups. And in these two groups, we have two different scenarios, namely those patients who were getting statins and those who were not getting statins. As I told you, there were about half of them did not have any blockages whatsoever. So we don't know if they were on statins. And anyway, there were about 944 people who were not getting any statins, and 485 people were on statin. Then we look at their final outcome in terms of mortality, in terms of heart attacks, or in terms of major adverse cardiovascular events. So we look at two different ways. The overall mortality, or the MACE as it is called, is plotted against the time here. Those people who had no detectable plaque, they had no blockages in the arteries that could be detected by angiography or other means, compared with those people who had non-obstructive blockages, that is less than 70%, which did not need any intervention. As you can see, those people who had no blockages whatsoever had a much better prognosis. That is, if they had no blockages, they had almost 95% survival rate at the end of 5 or 6 years, compared to those people who had some blockages, minor blockages. So when doctors say, okay, you don't have any critical blockage, you can go and do whatever you want, that is not an appropriate statement, because even if you have a non-obstructive blockage, the outcomes are going to be less desirable than those people who have no blockages whatsoever. As you can see here, the survival rate was approximately like 85 to 87%, which is much less than what it is compared to those people who did not have any blockage whatsoever. So this is the overall group of those patients who were on aspirin, statins, or no aspirin and statin, and we're going to look at the differentiation in the various subgroups. And here is a study, here's the same study, which looked at people who were taking aspirin and who had non-obstructive coronary artery disease. The people who were taking only aspirin, as you can see, no statins, is the group, this one. People who were taking aspirin and statin, that is in patients who had minimal blockages, who were taking aspirin and statin both, they had a much better prognosis. Their mortality was close to people who did not have any blockage whatsoever, compared with those people who were just on aspirin and no statin. If they had minimal coronary artery blockage, their overall mortality was close to like 87% or so. So this is a very important point of the entire study. That is, if someone has been diagnosed to have minimal coronary artery disease, that is, you go for an angiogram, they do the cardiac catheterization, they find out you have 30, 40, 50, 60% blockage, you don't need any stent or bypass surgery. In that case, taking aspirin and statin gives you the best 5-year outcome compared to being on just aspirin alone. So this is the most important message from this study. And if you look at the major cardiovascular events in the group that was taking aspirin alone compared to people who were taking statins, clearly it shows that people who were on statins at baseline had a much better outcome compared to people who were just on aspirin. So if you have no blockages whatsoever, it does not make any difference whether you're taking statins or not. However, if you have mild coronary artery disease or non-obstructive coronary artery disease, a combination of aspirin and statins provided the best overall cardiovascular risk reduction over the period of 5 to 6 years. So ladies and gentlemen, this is an excellent study which proves that people with existing mild to moderate coronary artery disease benefit significantly by taking aspirin and statins. But this is just for educational purpose. You need to consult with your physician to see what is most appropriate in your case based upon your entire history and clinical presentation. Thank you so much for watching this presentation. Hope this has been educational to you. We have several hundred videos on cardiovascular education, and please do subscribe to our YouTube channel and please do watch those videos. I will see you in the next video.